Tinnitus gone forever. Understanding is the key. The key to reducing problems related to chronic tinnitus and eventually finding relief from tinnitus is having a good understanding of what tinnitus actually is. Our brain works with a stream of nerve signals perceived as signs of tinnitus presence. This video can change your life by helping you understand the true nature of your enemy, tinnitus. We used to talk about tinnitus having many different parts and being a condition triggered not only by the various factors, but also influenced by certain preconditions. Some of these preconditions are well known, while others are still being studied as we learn more about the processes in our nervous system, particularly within our brains. With all the advancements in computer-assisted imaging techniques like MRI, and especially when exploring functional MRI for studying our brain, it becomes evident that modern neuroscience is just scratching the surface. There is still much more to be learned beyond what's universally accepted. However, some neural pathway development processes are well understood due to their importance. Some of these insights may apply to understanding the chronic tinnitus processes within our brain pathways, rather than being only related to our ears, neck, or other locations. It's essential to clarify that we are focusing on chronic, long-term tinnitus, which is the condition that causes many problems we discussed in some of our previous videos. So though there is no chance for tinnitus caused by earwax plugging the ear canal and tinnitus caused, for example, by a traumatic brain injury to be identical and follow the same extended process, and at the end resulting in the same long-term symptoms, however, the typical issue associated with tinnitus remains consistent, and we refer to the noise in our ears or head as the most common and easily recognizable tinnitus symptom that people usually talk about when they discuss tinnitus symptoms. In the very important and considered to be one of the most significant research summary report article titled Tinnitus and Underlying Brain Mechanisms, we can read as follows, and I quote, "Tinnitus, which often results from an insult to the peripheral auditory system, is associated with changes in the structure and function of many brain regions. These include multiple levels of the auditory system as well as the regions of the limbic system associated with memory and emotions. Given the broad extent of brain regions affected, it is unlikely that there will be a single drug or treatment modality that can effectively reduce or eliminate tinnitus. A multidisciplinary approach to the management of tinnitus patients is clearly needed." End of quote. So as we can hear, chronic, long-term, and even temporary tinnitus is known to cause some changes in how our brain is and works. There are many research papers which cover this subject, and many theories show up from time to time in some professional scientific magazines and journals. Still, it's important to note that Professor Pavel Yastrebov's tinnitus retraining therapy, based on implementing the neurophysiological model of tinnitus, is becoming widely accepted and more popular since its first publication in scientific journals and so-called white papers. We take pride in our association with Professor Yastrebov, and based on our research and many years of experience in using TRT in our treatments and therapies, we are staunch supporters who can attest to the exceptional value of his research and work. When you look at the screen and see a picture showing some parts of the brain which can be easily recognized, and based on Professor Pavel Yastrebov's neurophysiological model of tinnitus, are known to be involved in the chronic tinnitus condition or even temporary tinnitus. As we can see in the picture, the central part or element represents Professor Yastrebov's tinnitus model. It is called the limbic system. This part of the brain takes a very active role in presenting tinnitus symptoms to our conscious awareness. It's clearly shown in our pictures due to its significance and its role in the proper functioning of our brain, which sometimes leads to it being referred to as a separate brain. The limbic system is often recognized as the most important part of our brain involved in producing tinnitus symptoms, strength, and awareness changes, especially when we discuss severe or catastrophic levels of chronic tinnitus. Once again, as a reminder, when discussing severe or catastrophic levels of tinnitus, we refer to the Tinnitus Handicap Inventory Scale, otherwise known as THI. I encourage you to watch some of our videos where we explain the THI and why it is so significant when discussing tinnitus conditions. As science tells us, the limbic system supports many different functions, including emotion, behavior, motivation, long-term memory, and others. This part of the brain plays a crucial role in various brain functions, especially those related to our basic survival instincts and the fight or flight response. As we mentioned earlier, this is also a part of the brain that can make a drastic difference in how our tinnitus is and how it behaves. That's why, as we try to understand the true nature of tinnitus and why it behaves in certain ways, it's essential to know the role and significance of the limbic system. It influences whether we are aware or unaware of the presence of tinnitus, which can range from being extremely annoying and loud to less noticeable, and at the end making it challenging for us to pinpoint. What makes the difference is this understanding that the brain's limbic system is responsible for most emotional processing. Individuals with an anxiety disorder are known to have abnormally high activity levels in these areas. Now, please remember that most tinnitus sufferers experience high levels of stress and anxiety caused by tinnitus presence. On the other hand, any additional source of anxiety or stress present in our lives is known to have a dramatic effect on the awareness and strength of tinnitus-related symptoms by increasing what we could call a basic level of the limbic system activity to a much higher level. So what that means for us is that not only stress and anxiety are known to be responsible for 75% of tinnitus onset, but in fact, it's a combination of what we could call a based load of stress, which we can experience in our life daily in addition to stress and anxiety caused by a tinnitus presence. This mix can be very devastating to the tinnitus sufferer. This is why scientific research tells us that anxiety and tinnitus are linked to many conditions. People with tinnitus often live lives filled with high levels of stress and anxiety, affecting them on a daily basis. Constant tinnitus by itself, which is nothing but this abnormal activity in some parts of the brain, can disturb in many ways an individual's life and cause difficulty sleeping and focusing, but it can also trigger worsening episodes of anxiety and depression, as some other factors can even greatly increase this abnormal activity. So to have this good understanding of the chronic tinnitus condition, we need to remember that our actions can make all the difference. Our attitude toward tinnitus and emotional response can be as negative as expected, or we can try to learn to be calm and more relaxed by understanding the nature of tinnitus. We're not trying to tell you this would be nice and easy to do. There are many tools modern psychology has at its disposal, including widely recommended cognitive behavioral therapy. This is why our clinic has a registered psychologist and psychotherapist working with our tinnitus patients. Also, we are using elements or some of the 12 different therapies proven to be effective and relevant to ensure the success of the tinnitus treatments, especially when we have to work with some other problems, such as chronic anxiety. Based on our current understanding of tinnitus and over 15 years of experience working with thousands of patients, we are convinced that the psychological part of the treatment, often referred to as CBT, is a must element of successful tinnitus therapy. Our patients undergo training and education on how and why they should engage in the expected practices to succeed in working with their minds. We have many patients whom we refer to as distant patients coming from various locations in Canada and the US, especially when local professional tinnitus treatment clinics are not accessible to them. We strive to do our best to share all the required knowledge and expertise so that they can benefit from our therapies as our local patients in Ontario. This is so important because, unfortunately, most people have their subconscious minds working against them, and as we know now, the response to the tinnitus onset or worsening symptoms of tinnitus is usually a classical flight or flight response. This is what their subconscious mind is all about. Its purpose is to ensure we are safe, so our reactions to negative triggers or events will be instant, with no time for thinking left. The brainstem serves as the foundation of our subconscious mind. Our subconscious mind content, which is influenced by previous conditioning, holds many subroutines. It is important to remember that on average, we use only 10% or even less of our conscious, logical, and critical minds. For most of our lives, we operate on autopilot. For most inputs coming from our senses and our upper brain functions, our brain has a ready-to-use and instantly implemented response or course of action based on previous conditioning. This is like entering the bathroom and brushing our teeth. We do this without even thinking about it. It is all written in our subconscious mind. By this, we mean grabbing the toothbrush using the right or the left hand, putting the paste on the toothbrush, and finally going into the motion of brushing our teeth, going up and down or in some other directions. It's as if we are operating like robots, following the same set of patterns without any conscious thought. Our conscious mind might be occupied with thoughts, conversations with others, or listening to music or the radio. Meanwhile, we engage in actions that are pre-programmed into our subconscious mind through repeated training, often during childhood. The process of instructing our brain on responding to what we call triggers primarily occurs during childhood. We do this without even realizing it by observing our parents, siblings, and peers in learning in school. This process is remarkable because it remains active throughout our lives. Even when watching TV commercials, we are conditioned by repeated messages telling us what we should buy the next time we are in the store. The human brain is truly an extraordinary computational device, and we continually uncover new insights about it. By going back to the tinnitus process, more and more research suggests that certain streams of nerve signals within some parts of our brain can be recognized as a sign of danger, causing the tinnitus process and tinnitus symptoms. This is what makes the tinnitus process. Its presence is usually recognized as nothing more than a warning, meant to make us aware of what is sometimes labeled as a new dangerous development in certain parts of our nervous system, even if this is simply a mistake made by an overly sensitive brain. When we think about the number of known causes, factors, or medical conditions that can initiate tinnitus, we can easily recognize the need for the proper investigation to ensure nothing is happening. Sometimes it could be a sign of serious medical problems that could endanger our lives. So the family physician plays an important role in this investigation, as does an ear, nose, and throat specialist, an ENT, who will eventually recommend an MRI to make a diagnosis. Don't be surprised if you hear from an ENT specialist that tinnitus has no cure and that you should try to adapt to it. ENT specialists play a crucial role in investigating the causes of tinnitus. However, it's important to know that they are not tinnitus experts and specialize in other aspects of hearing rather than providing guidance on tinnitus therapies or treatments. As we all know now, especially from watching our videos, tinnitus resides in our brain, not in our ears. While the auditory system plays a role in the tinnitus process, let's remember that our ears don't produce or generate the tinnitus noise, or have much direct involvement in it. But the limbic system, not the auditory system, is responsible for our reactions to tinnitus presence, and us becoming nervous and afraid of tinnitus, especially when we do not understand much about its nature and causes. Treating this as a potentially threatening development of symptoms that we don't fully understand leads us not only to constantly focus our conscious attention on the nature of our tinnitus, but also train our brain to remain consciously aware of tinnitus as a noise that appears to be present in our ears or head. This way, we effectively program our subconscious mind by making our brainstem add some new neuronal pathways to include tinnitus at all times in our conscious awareness. From this moment on, regardless of the tinnitus strength, tinnitus will always be with us. Eventually, it will become stronger as tinnitus awareness becomes more important to our brain. Therefore, we often contribute to the progression of this distressing condition by elevating the significance of tinnitus in our minds. We effectively program our minds not only to generate tinnitus noise, but also to make every possible effort to guarantee the accurate delivery of noise to our ears and other associated symptoms. On occasion, going back to the topic of masking, what do you think is going to happen when we do all that it takes to prevent our brain from successfully making sure we hear tinnitus? Well, the brain will try harder and louder and use much more annoying and even higher pitched sounds. The competition with the brain is never successful. Still, in the case of tinnitus, it can make tinnitus become this horrible monster at the catastrophic level. So what can we do, and is there really a way to work with tinnitus regardless of its cause and how it is? With all this knowledge and learning about how the brain truly works, we can say yes, based on current scientific findings and understanding. There is a way, and to add to it, it is known to be extremely successful as it has been used for many years in many, mainly European countries. The key element is understanding how the tinnitus process affects the brain in various ways. While it causes some effects that we usually identify as noise or other symptoms. This is one of the reasons why neuroscience is becoming one of the most important parts of science, because it can explain, or at the very least, try to recognize the presence and understand the processes making the human mind and the brain work. Using this understanding and basing it upon scientific research, some therapies are commonly used and recognized as effective. Science uses advancements in modern computer technology, especially in imaging techniques such as functional MRI, to confirm the presence of tinnitus and observe specific brain activity in real time. Like many processes in our brain, tinnitus is not yet fully understood because of its complexity and involvement in many parts of the brain. However, it is known well enough to produce some theories that seem universally accepted and confirmed by countless research findings. It's true that there is no cure for tinnitus, and it may be difficult to find. Still, there is enough information and research findings to produce a solid foundation for some therapies, many of which have been used for over 2 decades now. Professionally, these therapies are utilized when dealing with chronic, severe, or even catastrophic tinnitus, as assessed by the Tinnitus Handicap Inventory Scale. Therefore, when using only one currently effective treatment, regardless of the underlying tinnitus cause, it is recognized that the progression of this treatment can limit the extent of tinnitus symptoms. This includes not only reducing the tinnitus noise, but also reducing the time during which patients are conscious of the presence of tinnitus. Moreover, during even the first stages of a proper chronic tinnitus treatment, and with some activity in our brain, tinnitus awareness, including noise in the ears and other symptoms, is first greatly reduced and then is eventually removed from the patient's awareness, as it becomes insignificant. But as soon as the patient's mind is not preoccupied with other activities, tinnitus awareness tends to return, as there is not going to be anything else competing for the brain's attention at that moment. This process will be reflected by decreasing numbers representing awareness of tinnitus during the day. Please note that reducing tinnitus awareness at night will take longer and more effort for the patient with some recommended activities and devices. What follows is used as the last part of the treatment, and this is a therapy which is based on the specialized set of brain conditioning protocols, or in simple words, a therapy designed to initiate the process of removing the connection between tinnitus as a process and the patient's attention or awareness. This is a real benefit of the treatment. The brain ignores the presence of tinnitus to some point because of the greatly reduced and almost removed importance of tinnitus as a process. The mind does not pay attention to it or is otherwise unaware of the tinnitus presence. So what happens to the tinnitus sound or noise? Well, it is gone as its other symptoms, once and forever. This is precisely why this type of treatment is so successful and only offered in a limited number of clinics, because it does require a different level of expertise and the collaboration of professionals from various fields working with the same patients. It also requires a highly personalized approach, a specific number of visits, and on average, it takes approximately 2 years to complete. Significant improvements usually become noticeable after 2 to 3 months. We've got some fantastic news to share for all tinnitus sufferers in Southern Ontario. Our clinic is currently providing low-cost consultations for a limited time, specifically for those of you who are suffering from severe or catastrophic tinnitus. To make an appointment, use a link to our website or call our clinic directly. Please do remember to leave a comment sharing what topics you'd like us to cover in our videos. And please don't forget to subscribe to our channel and give us a like if you find value in our content. Thank you for tuning in.